Thank you very much. I'm asked a lot, and I have some questions, but I'm going to let others go first, if anybody has anything. Okay.
I do.
Margaret, then Sal.
Like Tom, I probably have a lot of questions, but we'll be polite as chairs and just ask them one at a time so everybody has a chance to ask their questions. David, in terms of Charter Oak, and my questions are all focused on Charter Oak, what's the capability that the state has set about how many people it can take into the program? Is there an upper limit? Is there a budget cap that's been set? I know the initial response was, exceeded your expectations. If all those people are accepted in, is there some number at which people are going to be cut off?
Well, we have an appropriation for this, which is I think $11 million this year that we can spend. So, that'll have to be a decision on the part of the administration about whether they want to exceed that. If they were to exceed that, they'd have to come back in, and we'd have to come back in and seek deficiency funding to go above the $11 million. Or we're going to have to curtail enrollment at some point. But we do have a fixed appropriation in terms of how much we can take in. The other thing that I would mention, though, Margaret, is that the limits on Charter Oak enrollment are driven in part by finances. Obviously, money's always an issue, but it's also relative to the networks that the plans can bring to serve the population. We're looking now, and we're going to continue to look each month at how many people can be enrolled based on our algorithms on what their provider network is going to support. We're not going to enroll people beyond that where we'll be in a situation where they're over capacity.
And I think we would appreciate, as the authority, being able to get sort of a constant update on where that situation is. So I'll defer to
Things
other
are
people's
kind of
questions.
fluid right now, but I would say, in the next few months we'll have some reports that'll be able to show you where the enrollments are by county and what we think network capacity is.
Sal?
I want to thank you for your overview. I have a Charter Oak question myself, but I think you gave us, as I said, a good overview, but specifically maybe at the tree level. So if you take somebody who makes like maybe 41, 42,000, and I would assume that person would likely be in the middle band.
Well, I mean, there's a sliding scale of premiums that starts. If you look at those bands, I didn't bring that, what those contributions are, but that 0 to 150, 151 to 185, 186 to 235. The subsidies continue all the way up to 300%.
I understand.
They drop off. Above 300%, you can still participate, but you got to pay the full premium.
Okay, I'm figuring federal poverty level for families around 20,000. So that's where I said if I make about 42. Let's say it's the middle band. So as if I would pay the first $600.
That's correct.
Okay, and then if I were to be ill, I would pay up to $600 additional dollars, and then there would be a cap.
Then there would be a cap.
Okay, and is there also a cap in the benefits? Is that $100,000 a year?
It's $100,000 a year.
So if I were to be extremely ill and to go above that, what would happen at that point, David?
If you were to go above it, Charter Oak isn't going to pay beyond the $100,000. My thinking is that a lot of those folks that hit, a really unfortunate circumstance like that, those folks are going to be probably coming to us on the Medicaid side in terms of being a spend down situation for Medicaid eligibility. But there is an annual maximum. So, Charter Oak is not the answer to everybody's problems. I mean, for folks that have that kind of serious situation, it's not going to cover above $100,000 a year.
David, I'm just trying to understand this. So if it were to be well over $100,000, then the spend down situation would happen. Maybe the person lose their house or whatever. And then when they have lost enough assets that they qualify for Medicaid, then Medicaid would kick in? That's
correct.
Thank you very much.
I mean, one of the things that I think, I don't want to give a plug here for personal policies, but the state has traditionally kept our medically needy income level, which is the point where people have to spend down their income for people that Sal's talking about, is rather low. I mean, our medically needy income level is about 60, I don't know, well, Sharon knows the number. It's about 60% of poverty or something like that. And at various times, the states looked at raising the medically needy income level to the poverty limit, which doesn't sound that radical to say that, if once you hit the poverty limit, maybe the state would start picking you up in Medicaid. That's expensive. I mean, I forget what the number was, $30 million just to do that. But that's a real need in terms of people looking at expanding access. That it's nice to think about covering people that are your basically healthy population, but those are people that are already in pretty serious distress. I mean, if they're in that spend down situation, they do need help.
Thank you. And I know that you all have been working your tails off on a variety of levels. I'm very encouraged to hear that you're moving more quickly now again on PCCM. But I got some questions on this transition around Husky and the tie-in to Charter Oak. You said part of the reason why it's totally different plans, submitting in Medicaid only for Charter Oak was as a result of the Freedom of Information stuff.
Partly true, yes.
Which, for anybody contemplating more comprehensive reforms and understanding all of those things, what the governor and the attorney general and the advocates push for in terms of the public's right to know around freedom of information is extremely common sense, and I know of at least 20 other states that are planning on pushing legislation this next year to demand that type of accountability and how we spend our public dollars. So I want to applaud you all for sticking up and doing the right thing there. I've also, though, heard that part of the concern with why we didn't see some of those plans come back in here is the fact that to bid for Husky, you also had agreed to participate in Charter Oak.
That is true.
And I'm concerned that there's no provider networks as of now, and that the plans are building, and I'm hearing from providers that are really out there hustling to try to build, but that we're going to start pushing people into plans that don't really exist at this point in time, where we've already had the transition that goes to my earlier question. But I guess the crux of the question that I want to ask right now is how much more are we paying, if at all, now on a per capitated basis for Husky than we were a year ago under the last plan? And if you could also incorporate or break out for us the carve-outs for prescription and dental, because I think we're probably subsidizing the Charter Oak plan even more through higher capitated rates for the Husky stuff.
Husky rates are higher. I can't give you today. I didn't bring numbers today to tell you that, so I can't really give you a full breakout on that.
Can you give us a ballpark percentage? Is it 5%? Is it 20%? Is it?
It's not 20%, and it's not 5%.
Okay, so you can get back to us again. I'm not going to put you in the hot spot. Yeah. Okay.